Hi, I'm Kathleen Vacchelli, and I'm a nurse practitioner. I am the president and owner of Atlas Behavioral Health in Palm Coast, Florida. Atlas Behavioral Health is a psychiatric mental health practice, which means that we deal with many types of mental health and psychiatric issues, as well as different life problems and issues that occur today in society. Some of the problems or issues that I address are many. We have different things such as people that call up with addiction problems. They might have PTSD, which is post-traumatic stress disorder, and that could be anywhere from sexual abuse to war-related issues. We also deal a lot with bereavement and grief for people who are presently even going through the grieving process or have anticipatory grief. We also deal with anger management, a lot of anxiety disorders, especially in today's economy, as well as mood disorders, ADHD, which is attention deficit hyperactivity disorders that we see a lot in kids today, as well as individual family therapy. We also have therapists here that deal with behavioral problems, especially in children. And we also deal mainly, well, I shouldn't say mainly, but we do see a lot of depression today. The population of people that we do serve, they range from age 3 to 93. So we may see very young children that are having behavioral problems in daycare, and a mother may come in and say that her child is getting ready to be kicked out of daycare for the third time. And here she is, a single mother trying to make it. And what we try to do is not put children on medication if we don't have to. And that child may see one of our behavioral therapists. We also see a lot of teenagers who are having struggles in school, or there may be some addiction problems. We also see baby boomers, people who are losing their jobs or maybe going through some relationship problems. And also we see the senior population. They may be people that are away from their families down in Florida, and they're getting very depressed. So it ranges, from birth to death, basically. We get our referrals from many sources, mainly from insurance companies, because all of us are on different insurance panels. So when a patient might call up in need of, let's say, help with addiction, they would call up their insurance company to see who their providers are in the area. We also get lots of referrals from the physicians in the area. We are going on 4 years right now in Palm Coast as Atlas Behavioral Health. Also, we get referrals from the schools. We get referrals also from word of mouth, people who have been satisfied with our services and tell others about it. As we all know, many people are losing their jobs. They're losing their homes. It's causing problems in the family. People are divorcing. People are drinking more. These are difficult times for everybody. So we definitely have to be very attuned to what's going on. So yes, we are seeing quite an increase in people seeking mental health help. Well, first of all, let me explain to you what happens when a person does come into Atlas Behavioral Health. They usually see me first so that I can do a psychiatric evaluation on them. And that takes about an hour. And I'll ask them different questions. For instance, have they ever had problems before? What is their family history? What is going on in their life at this time? What are their medical problems? And then I figure out what the diagnosis is. And many times, these people I have to put on medication. Now, I do give them choices. We can either try it without medication, and maybe if we can get you into some therapy, and then see how that works out for you. What we find is that psychopharmacology, meaning giving them the medication, and psychotherapy work the best to get the fastest and most successful results. A lot of times, too, I have to look at a patient's lifestyle. They may be in a lot of pain, and maybe they're overweight, maybe they're smoking, maybe they're drinking too much. So we definitely have to look at medication possibly, psychotherapy, and change in lifestyle.